Many men assume that erectile dysfunction is simply what happens as you get older. They notice a gradual change, perhaps over months or years, and accept it as a natural part of aging. But what most men don't realize is that erectile dysfunction is rarely about age alone. In fact, it's often one of the earliest signs that something else in your body is beginning to change, something that may not yet show obvious symptoms. Your cardiovascular system, your hormones, your metabolic health, all of these can affect erectile function long before you notice anything else. If you're over 40, this is something worth understanding, not ignoring. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In today's video, I'll help you understand what erectile dysfunction may actually be telling you about your overall health and why it's important to look beyond age as the only explanation. To understand erectile dysfunction, you first need to understand how an erection actually happens. It's not just a physical response. It's a carefully coordinated process involving your nervous system, blood vessels, hormones, and even your mental state. When you become aroused, your brain sends signals through the nervous system to the blood vessels in the penis. These blood vessels relax and open, allowing blood to flow in and create an erection. At the same time, veins that normally drain blood are temporarily compressed, so the blood stays inside. This entire process depends on healthy circulation, balanced hormone levels, and proper nerve function. As men age, certain factors can begin to interfere with this system. Chronic conditions like diabetes or high blood pressure, lifestyle habits like smoking or lack of exercise, and hormonal changes can all affect how well this process works. That's why erectile dysfunction is often less about aging itself and more about what's happening inside your body over time. One of the most common causes of erectile dysfunction is poor blood flow. The arteries in the penis are smaller than those in other parts of your body, which means they can be affected earlier by conditions that damage blood vessels. If you have high cholesterol, high blood pressure, or early-stage atherosclerosis where fatty deposits begin to narrow your arteries, the penis may be one of the first places where reduced circulation becomes noticeable. This is why erectile dysfunction can sometimes be an early warning sign of cardiovascular disease. Many men don't realize that what feels like a sexual health issue may actually be a signal from the heart and blood vessels. This is not something to panic about, but it is something worth taking seriously. Another important factor is blood sugar and metabolic health. Diabetes is one of the leading causes of erectile dysfunction, and it affects the body through multiple pathways. High blood sugar over time can damage both small blood vessels and the nerves that control erections. This makes it difficult for the body to coordinate the process properly. Even before a formal diabetes diagnosis, insulin resistance and prediabetes can begin to influence erectile function. If you're overweight, especially around the waist, or if you have a family history of diabetes, these metabolic changes may already be affecting your sexual health. This connection is often overlooked, but it's one of the most important links to understand, particularly for men in their 40s and 50s. Hormonal changes also play a significant role, especially testosterone. Testosterone influences sexual desire, energy levels, and erectile quality. As men age, testosterone levels naturally decline, typically starting around the age of 30 and continuing gradually over time. Low testosterone can reduce libido, make erections harder to achieve or maintain, and contribute to fatigue or mood changes. However, low testosterone alone doesn't always cause erectile dysfunction. It's usually one factor among several. What matters is overall hormonal balance. If erectile difficulties appear alongside low energy, reduced motivation, or mental fog, checking hormone levels may be an important step. Psychological and emotional factors are another piece of the puzzle. Erectile dysfunction isn't always physical. Stress, anxiety, depression, and relationship difficulties can all interfere with sexual performance. When you're stressed or anxious, your body activates the fight or flight response, which makes it difficult for the relaxation systems needed for arousal to function properly. Over time, this can create a cycle of performance anxiety, where worry itself becomes a trigger for erectile difficulties. Addressing mental and emotional health is just as important as addressing physical causes. Medications and lifestyle habits can also contribute. Certain blood pressure medications, antidepressants, and treatments for prostate conditions may affect erectile function as a side effect. Smoking damages blood vessels and reduces circulation. Excessive alcohol can interfere with nerve signaling and hormone production. A sedentary lifestyle weakens cardiovascular health and contributes to weight gain, both of which can affect erectile function. The encouraging part is that many of these factors are modifiable. Small, consistent lifestyle changes can make a meaningful difference over time. It's important to remember that every man's body is different. Erectile dysfunction can have many causes, and those causes often overlap. What affects one man may not affect another in the same way. The purpose of this video is to help you understand the possible reasons behind erectile dysfunction so you can have informed conversations with your doctor. This is not a diagnosis, and it's not medical advice tailored to your specific situation. If erectile dysfunction is new, persistent, or accompanied by other symptoms, seeking medical evaluation is an important step. A healthcare professional can help identify the underlying cause and guide you toward appropriate care. So let me ask you this. Have you ever wondered whether a change in sexual health might be connected to something else happening in your body? If you feel comfortable, share your thoughts in the comments. I read them, and they help shape future videos. If you found this video helpful, consider subscribing to the channel. I post new content every week, focused on men's health and urology, explained in a clear and practical way. In the next video, I'll be talking about testosterone replacement therapy, what it can and cannot do, and who may actually benefit from it. Until then, take care of your health, stay informed, and remember that understanding your body is the first step toward protecting it.